Hello, everyone, and welcome to this session of Facebook Live, where today we're going to be speaking about sleep in children with cerebral palsy. My name is Evelyn Constantin. I'm a pediatrician specializing in sleep disorders in children, and I'm also the director of pediatric sleep medicine and the sleep laboratory at the Montreal Children's Hospital at McGill University. Today we're presenting this session as part of our Better Nights and Better Days for Children with Neurodevelopmental Disorders, and also in recognition of World Cerebral Palsy Day. So I'll be doing a presentation probably in about 15 minutes or so, and you have the opportunity to ask questions, to write down questions and send to us. And we hope that we'll be able to answer them during the session. And if not enough time, we will definitely send you an email with responses. So this is just a slide showing our Better Nights and Better Days for Children with Neurodevelopmental Disorders project, which we'll talk about at the end of the session. I want to thank my colleagues, Dr. Penny Corkham and Dr. Shelley Weiss and Sydney Dale, who have been helpful in this presentation, but also in this project as leaders for this study that I'll talk about at the end. But I'll start off by providing a brief overview of cerebral palsy, as well as describing sleep problems in children with cerebral palsy. And at the end, I'll describe the Better Nights and Better Days study that, and if you're interested, we'll provide you the information on how to get involved and get information. So sleep problems are quite common in children. In fact, 25% of typically developing children have a sleep disorder of some sort, so 1 in 4 children. And up to 90% of children with neurodevelopmental disorders have a sleep problem. Insomnia being a very common problem in children with cerebral palsy. As you can see, 36% to 90% have been quoted in the literature. Cerebral palsy is defined as difficulties in movement or motor control due to a non-progressive brain lesion that likely occurred during fetal development or early infancy. And it's the most common cause of physical disability among children worldwide. There's different classifications of cerebral palsy, or CP, and the gross motor function classification system is a common way to classify, and it's based mostly on mobility and ambulation. So as you can see, not sure if you can see my mouse here, the arrow, but it's classified as a GMFCS of 1 for children who are ambulatory, 2, they can walk without aids, 3, walk with some assistance, 4, mobility requires wheelchair assistance, and 5, they're dependent for mobility with others. Associated medical conditions are common in children with CP. They include this list here: epilepsy, feeding issues, gastroesophageal reflux, visual deficits, commonly muscle spasms and spasticity, developmental delay, and some intellectual impairment. So why are sleep problems more common in children with CP? So depending on the list that we just described earlier, these can impact sleep in children. So for example, motor impairment, muscle spasms, spasticity can make the children have some difficulties and inability to move independently in bed. Also, some children have to wear splints or orthotic devices, and that can be causing some discomfort and some disruption of sleep. Some children with CP, especially those who have difficulty with mobility, will need to change sleep positions, or their caregivers or parents will have to change their sleep positions during the night. And this could lead to awakenings, of course, during the night. Some children with CP have seizures or epilepsy, and this can sometimes cause night wakings and may lead to daytime sleepiness. Children with CP may also have sleep disordered breathing, which is a very common sleep disorder in all children. That's characterized by snoring and obstructive sleep apnea, or basically pauses during sleep. And sleep disordered breathing can be common in children with CP. And feeding issues also can lead to some pain from reflux, and that can cause awakenings, or some children with more severe CP may require feedings by a gastric or a stomach tube. And this can interrupt sleep as well. And finally, some medications that are used in children with CP for their other conditions that they may have can have some side effects that could disrupt sleep. So some negative effects on the child include difficulties with daytime functioning, behavior issues, falling asleep during the day because of sleep disruption, and this may lead to decreased participation in social and academic activities. And of course, there can be negative effects on caregivers when the child is having sleep disturbance. Often the parents and caregivers have sleep disturbances with frequent nighttime awakenings, some anxiety in terms of observing the child during the night and monitoring, making sure that the child is well and safe. And there may be some negative effects of poor sleep on the caregivers in terms of stress and some irritability, and it does affect the quality of life of both the child and the family. So are there ways to help children with CP who have sleep problems? Definitely for children with obstructive sleep apnea, medical treatments that are determined by the treating physicians can include nasal spray with steroids to reduce inflammation if that's one of the causes for sleep apnea in the child. And the most common treatment of sleep apnea, obstructive sleep apnea worldwide, is surgical treatment, removal of adenoids and tonsils. And that has to be, of course, in conjunction with the medical team and the surgeons, specifically the otolaryngologists. For the common problem of behavioral insomnia, difficulties getting to sleep and maintaining sleep at night, treatment would start initially with behavior changes, parental education about sleep, and good sleep habits and practices. And that's what we're trying to help families with the Better Nights, Better Days NDD study, is that we're providing parents and caregivers with some suggestions of behavioral treatments that can help deal with common sleep issues in order to improve the sleep in the child and others. And specifically, we provide some techniques and relaxation activities that could be helpful. With the Better Nights, Better Days program, we wanted to support parents and caregivers of children with CP who may have sleep problems. We are also including children with other neurodevelopmental disorders in our study, including those with ADHD, FASD, and autism. And we've brought together experts across Canada to develop an evidence-based intervention that would be delivered by the internet. So families would use an online platform to access these modules. And we thought that an online platform would be helpful in order to reach out to as many families as possible, since we know that access to evidence-based care and sleep evaluation across Canada can be sometimes difficult, especially in areas where there aren't sleep specialists or sleep laboratories. To participate in this research study, we're including children 4 to 10 years old with cerebral palsy, but also, as I mentioned, we're also including children with ADHD, autism, FASD, and fetal alcohol syndrome. And for those children with CP, we're including children with GMFCS 1 or 2, so the more milder forms of CP. And children must have some form of insomnia, so difficulty falling asleep or maintaining sleep or frequent awakenings. And this is as determined by the parents and caregivers. In terms of expectations for the parents and children who participate in this research, so those parents who consent to being involved in this study will complete some parent questionnaires and will be asked to read through some online modules describing sleep and strategies to help with insomnia and sleep problems in their child. We've tailored the modules to children with CP and the other 3 disorders I mentioned. So if you have a child with CP and you are involved in this study, the modules that you will have access to will be tailored to children with CP by our expert research group. And to measure sleep, the children in the study will also wear a watch-like band that's non-invasive and not painful, which measures sleep and wakefulness by assessing movement. And since this is a randomized controlled trial, what that means is that during the study period, some of the families will be randomly assigned to the sleep intervention group, and other families will be randomly assigned to receive other useful information. But at the end of the study, we are determined that all families who have consented to participate will get access to the sleep intervention and the online modules, especially if they were in the group that did not receive that intervention. To sign up to participate, here's some information to our website. So ndd.betternightsbetterdays.ca. And the website actually has some interesting information about the study and other information. And you can also access us through facebook.com and all these other social media avenues. And we'd like to thank our funders who have made this study possible, in particular Kids Brain Health Network, which is a Canadian network of centers of excellence, and it's the first trans-Canada initiative dedicated to understanding brain development and to helping children and their families overcome challenges of neurodevelopmental disorders. So we really appreciate their support in this project. And I also want to thank Dr. Penny Corkum and Dr. Shelley Weiss, who are the leads of this project across Canada. So I'd like to thank you for your attention, and we'd like to answer some of your questions if you have any. And again, if you ask a question and we're unable to get to it during this presentation, we will definitely send you responses by email. So I'm sure you see the cascade of my screen. That's just so that I could be able to see some of the questions that some of the viewers may have. I'll wait a few more moments in case there are questions that you'd like me to help answer. So what I'll do is I will just go back to the presentation. I know I went a little bit fast, so I'll just go back and place the eligibility criteria so that in case some of you would like to either disseminate this information or if you are a parent or caregiver with a child with cerebral palsy or the other 3 conditions, FASD, ADHD, or autism, we are including children 4 to 10 years old with GMFCS 1 or 2 in case of CP, and children should have one symptom or other symptoms of insomnia. And these would be the expectations or commitments from the families participating, getting access to online modules and strategies. And at the end, depending on, regardless of which intervention group the families are in, at the end of the study, all families who have consented to participate will get access to the sleep intervention and online modules. And again, this is the information to check out our website or to participate in the study if you're interested, or at least get more information. So I'd like to thank you all for your attention and participating in this session. Again, feel free to send us questions even after the video has ended, and you can check out our website for future presentations if you're interested. Thanks again. Have a good day.